Welcome, everyone. My name is Corinne, and I will be your moderator this evening. I am so excited to welcome Marty Santizo as our speaker tonight for a talk on the future of whitening, targeting a new generation. Before we get started, I would like to take a moment to go over some housekeeping. If you have a question, please type it in the box labeled "Have a Question," and we will work with Marty to get those answered. This webinar is sponsored by Colgate, and CE is not available live or on demand. Marty, welcome. I will pass on over to you now.
Welcome, everyone, and thank you so much to Henry Schein for allowing me to speak tonight. My name is Marty Santizo, and I am a registered dental hygienist. I am a professional education manager with Colgate Oral Pharmaceuticals, and I would like to discuss with you the future of whitening, targeting a new generation. I'm sure many of you are familiar with this site. Many of you have made a lot of these trays in the past. The whitening concept was stumbled upon in the 1980s. But if you look back, it really hasn't changed a whole lot in the past 35 years. We're still using a water-based, aqueous, viscous, thick gel that goes either into a preformed tray or a custom tray. If you look at some of the other industries, though, from the 1980s, that is certainly not true in those industries. I don't remember the last time I had a physical map in my car, and I don't even know if any of you recognize these other types of technology. It's been a long time since I've seen anybody walking down the street holding what we called the boom boxes back in the 80s, or the dial phones. They've all been replaced with just our little pocket cell phones with a lot of other digital technologies involved as well. So let's talk a little bit about whitening, because anytime we do a dental procedure in the office, we need to talk to our patients about advantages and disadvantages. And every procedure that we do has advantages, and everything that we do has some disadvantages. So what are some advantages and disadvantages of whitening our teeth? We know that the advantage is to have whiter teeth, right? We're going to look more beautiful. We're going to look younger, whatever the patient envisions as far as having whiter teeth as that advantage. But there are some disadvantages. The disadvantages for the patient can be sensitivity. There's a lot of patients that won't even speak with us about whitening because they've heard that it will cause a lot of sensitivity. They know they already have sensitive teeth, and so they just avoid that. They don't even want to talk about whitening. And we know that there are things that we can use to help alleviate some of the sensitivity, but some of those things like potassium nitrate, even though there are some whitening systems that include potassium nitrate, it takes several weeks up to even a few months before they are completely desensitized. So a lot of times if the whitening treatment is a couple of weeks long, the desensitizing doesn't even kick in until after they're done whitening. And actually, in 2019, if you look in the Journal of the American Dental Association, there is a systematic review that was published where they talk about the use of analgesics to help reduce tooth bleaching pain or sensitivity. And this report states that analgesics that are used for reducing pain from sensitive teeth with bleaching do not work. They actually they're not effective. So it's interesting because a lot of the things that we think are helping to reduce sensitivity for our patients really aren't doing the job, or aren't doing the job quick enough. And then there's the wear time. You know, patients don't like to have to wear a tray for several hours, for many days, you know, because it increases the sensitivity, and it also can be uncomfortable. There's also disadvantages for the practitioner. You know, we have to take chair time in order to fabricate a tray. And chair time equals money, right? The longer they're sitting in a chair while we're taking the impressions, if we either have them sit in the chair while we make the tray, then we have to go back and go through that whole procedure of making the tray and the patient sitting in the chair. Or if we don't want to take up chair time, we send our patient home, and then they have to come back for a second appointment, which also takes up more of our chair time and is more inconvenient for the patient. So that could be a disadvantage. We know that when we are trying to influence the color of the teeth, we are working with both intrinsic colors and extrinsic colors. So we know that enamel is translucent, but dentin, is opaque. And so a lot of the color that you see on the tooth comes from that, the inside of the tooth, or the dentin. But there's also extrinsic stains that can stick to the enamel. So even though the enamel is translucent in color, if you have extrinsic stains, then it can make the tooth appear darker. So there's a couple of different ways that we can treat the intrinsic stains. We know, of course, we can treat the extrinsic stains by doing a good prophylaxis. But the intrinsic stains, we either have to bleach with a peroxide of some sort, or we have to cover them up and restore them. So we put veneers or crowns or composites to hide the color. And in modern days, the most commonly used active ingredients for whitening is hydrogen peroxide. There's also carbamide peroxide, which we know breaks down into hydrogen peroxide. So when you are comparing a carbamide peroxide to a hydrogen peroxide, it's not like comparing apples to apples. Hydrogen peroxide, you have to multiply it by 3 to be comparable to the percentage of a carbamide peroxide. You can see here carbamide peroxide is a large molecule, and it has to break down first into urea and hydrogen peroxide. And from there, then the hydrogen peroxide has to break down into water. And then there's a leftover, or what I call a reactive oxygen. So you can see how this works. When you have hydrogen peroxide, like I said, it breaks down into water and a reactive oxygen. So if we're looking at the chromophores, which are the color molecules that create that extrinsic stain, that coloration on the external part of the enamel, we can see that chromophores have a lot of double bonds. And when there are double bonds, a lot of double bonds, it appears darker. So what this reactive oxygen does is it goes and breaks up those double bonds. When you break up the double bonds, now the tooth is able to reflect more light, and so it appears lighter. I know many of you are very familiar with the Vita Shade Guide. A lot of you use these in your offices for your restorative work. And as a matter of fact, they were invented with the incipiency of porcelains and composites that we were using on teeth. And you can see with the Vita Shade Guide, because it was used for restorative, that they have separated it according to chroma. So you'll see it goes from lightest to darkest in different coloration or chromas. And so, the red-brown colors, lightest to darkest. And then back to the lightest of the red yellows, same all the way down to the darkest. And then light to dark with the grays, light to dark with the red grays. And that's important because our lab people, or the people who are working to help recreate the color of the tooth, they have to look at the chroma first, and then they look at the value, or that shade within the chroma. This is wonderful for restorative work. However, it's not so great for when you're talking to your patient and helping to manage their expectations and their perceptions as far as lightest to darkest when you're talking about bleaching the teeth. So what I would recommend is that you have one Vita Shade Guide in your office that's dedicated just for bleaching patients, so that when you are looking at colors of the teeth, when you're talking to your bleaching patients, it only goes according to value from lightest to darkest. Because our patients really don't care if they have a lot of blues or the gray colors, if there's more yellow or orange. They don't care about the chroma so much. They want to know how dark they started and how light they became with our bleaching procedure. So I would recommend that you take a screenshot of this lower Vita Shade Guide that we have put in from lightest to darkest according to value. The reason why, when you're talking to your patients, well, let's just take a patient here for an example. Say your patient, Mrs. Jones, comes in, and Mrs. Jones is an A3 when she starts out, and she would like to get lighter teeth. A couple of weeks later, after you've sold her a bleaching kit to take home, she'll come back and you take the shade again, and now Mrs. Jones is an A1. Wow, Mrs. Jones, according to the shade guide that they're looking at, it appears that they've only had 2 shade changes. So Mrs. Jones is feeling a little disappointed because she just spent $250 or whatever it is that you charge for your take-home bleaching. And she's looking at that and going, wow, I didn't really have that much of a change. Let me just show you now according to value, though. If you were to use this one down below, Mrs. Jones, like we said, she was an A3 when she came in. So she really was about the middle of that value shade variation. When she came back, once again, she was an A1. Now when Mrs. Jones is looking at that, you can very easily say, Mrs. Jones, look, you had a 7 shade change. So it helps the patient to kind of see where they started, where they ended, and it helps with their expectations a little bit better. So Mrs. Jones goes home. She tells her husband about it. Mr. Jones now wants to bleach his teeth. And he comes in, according to the traditional shade guide, he comes in at a C4, and you can see he's fairly dark. When he comes back after 2 weeks, wow, Mr. Jones, this looks like he had about a 6 shade change. But let's look at it according to just value. Mr. Jones was at the very bottom of, I call this the bottom of the poo pile. He was very, very dark. And when he came back in a couple of weeks, oh my goodness, Mr. Jones, now what you can show Mr. Jones is that it was actually 13 shade changes. So you can see how it really helps with your patient's expectations, how they perceive that darkest to lightest appearance. Well, we have known for many years that there are ways that we can enhance the bleaching. We can enhance hydrogen peroxide. One of the ways that we can do it is by increasing the percentage. So when we talk about that aqueous viscous gel, that water-based gel that we've used for many, many years, in order to enhance that, we have to add percentage. So we know that 10% is good, 20% is better, 30% is even better, right? The more percentage we add, the more enhanced the whitening. We also know over time that if we are keeping it on the tooth for the full amount of time. So we know that hydrogen peroxide, it takes about an hour and a half for hydrogen peroxide to break down completely. Carbamide peroxide, because it first has to break down into urea and hydrogen peroxide and then break down from there, it can take anywhere from 6 to 8 hours to break down. So we know that if we keep it on for the full amount of time, that we can enhance the whitening as well. Another thing that we've looked at over the years are these blue lights. You know, a lot of very popular in-office bleaching has these blue lights. And even now there's some that are take-home that include blue lights. And some people, you know, swear by the blue lights. Others maybe are a little bit more questionable. I actually worked for a bleaching company for many years and went in as a regional manager, went into many, many offices, first on the East Coast and then the Pacific Northwest. And I can tell you, I spoke with many, many doctors, and a lot of them would say, you know, I don't really believe that the blue light does a whole lot, but my patients believe in the blue light. And so I have a blue light because they are convinced that that blue light enhances the bleaching. So I've seen a little bit of both. I've seen studies that, you know, you can follow whatever you want to believe. But in dentistry in the past, we have used the blue light very commonly to try to enhance the hydrogen peroxide. However, over the last few years, they have found that if you can reduce the nanometers from the blue range down into the violet or indigo range, that you can enhance the bleaching. So my question to you is, why are we still staying the same from the 1980s? Why haven't we moved on to newer technology? So I'm here today to introduce to you a new technology that has just come out. And it's actually 2 parts to this new technology. And both of them are brand new to dentistry. It is a technology that produces a powerfully fast whitening. No mess is involved. It's very easy to use, and it's designed for no sensitivity. So you can see that there were 2 components to this new technology, and both of them are brand new. So the light is very different because you can see that this light is down in the purple range of, you know, the light spectrum. So it's 410 nanometers as opposed to several of the competitors that are out there that are all in the blue range, anywhere from 450 up to about 465 nanometers. When you decrease the light wave, you actually can impact the bleaching and enhance it. The lower the wavelength, the higher the energy that is produced. So here's a view of light wavelengths, and you can see that the longer the wavelength, the lower the energy. So it's kind of like, I liken it to being in the ocean when it's those nice rolling waves, very easy to jump the waves. You don't feel like, it's not a scary situation at all. But if you reduce that wavelength, then I liken those to those really strong waves with the really, the very, very high energy. It's the same thing with the light. Much higher energy, lower wavelength, shorter wavelength. I took a picture of, this is the new purple light, or in the indigo range, as opposed to a couple of competitors that you can see very nicely in this picture are definitely in the blue range. The other thing that I want you to notice is there might be 8 or 10 LED lights across the incisal area of the facial. Whereas with this device, there's over 700 LEDs, all in that purple range with the shorter, higher energy wavelength. I just want you to look at this video, because what we did to show you the difference between these two wavelengths is we painted the teeth of a typodont with natural white glow paint. And you can see on the left, that will be the shorter wavelength. On the right is the blue light with the longer wavelength. I'm just going to show you what happened with that natural white glow paint. So they shine it for the same amount of time on this typodont. And you can see that that shorter wavelength that has the higher energy, it really enhances that glow paint. It makes it much more energized, much whiter in appearance, and it stays whiter for a much longer period of time. That's with glow paint, however. So with this new LED, the wavelengths are shorter with more energy behind them for a faster, more enhanced whitening. The device is also rechargeable, so you have a constant, stable output every single day. The other part of this platform is the actual bleaching. So the bleaching is also very different than what you've used in the past. This is the first alcohol-based bleaching technique. In this pen, there's a little cap on here, and it has a little brush on there. On this side, there's a little clicker, just like a pen. And inside the pen, there is an alcohol solvent. There is a liquid to solid polymer. So in the pen, it's liquid. Once it goes onto the teeth, the alcohol evaporates very quickly, leaving a solid polymer holding the hydrogen peroxide. I'm just going to show you how this works. On the upper, you can see, here's that little brush. They've clicked it so there's a little drop that appears, and then you can precisely paint that onto the tooth. Within about 10 seconds, that alcohol evaporates, leaving a very thin polymer that holds the hydrogen peroxide right up against the tooth. Once that has evaporated, you cannot remove that thin polymer with lip action, tongue action. You can't remove it by drinking water or coffee. You can remove it by drinking alcohol, because alcohol is a solvent. So we always have our patients wait for about 4 hours before they drink any alcohol. On this video down below, you can see that once it's been painted onto the surface, you can't just remove it with lip or tongue action. Saliva doesn't remove it. Water doesn't remove it. You actually have to brush it off or remove it with something. I think that wasn't a toothbrush, but it can be brushed off. So we liken this whole process sort of to, if you are a chef and you like to make a reduction sauce, we know that we put the sauce in a pan and then we gently heat it to evaporate the water or the alcohol or whatever is in the sauce. And as that evaporates, it concentrates what's left in the pan. It makes it more intensified and concentrated so that you have what they call this reduction sauce with a lot more flavoring. It's the same idea with this pen. We paint this onto the tooth. It evaporates, the alcohol evaporates, leaving that solid polymer with now a more concentrated hydrogen peroxide. So the hydrogen peroxide that's in the pen is a 6%, but what's on the tooth is going to react like a much stronger percentage. I'm just going to show you on this video, we're just going to take a little peek into the pen. So here we have our pen, and you can see that there's some components inside to make up this bleaching. There's 6% peroxide, and there's 94% of the other two ingredients, right? The alcohol and the liquid to solid polymer. So initially we have 6% hydrogen peroxide in the pen. We can apply that to the tooth. We just click the end. The first time you click, you have to, what I call prime the pump. You might have to click 15 or 20 times, and then a little drop will appear. After that, it really only takes about 1 or 2 clicks, and you've got that drop again. You paint that onto the tooth. You can be very precise about where it goes and how it sits on the tooth, and then the alcohol immediately evaporates. It takes about 10 seconds. What's left now is a more highly concentrated form of the hydrogen peroxide, because we just got rid of a large portion of that 100%. The peroxide diffuses very rapidly into the tooth, and that polymer holds it down into up against the tooth. So now what was 6% hydrogen peroxide is a much more condensed, enhanced hydrogen peroxide. So now with the aqueous gel, instead of adding percentage, what we're doing is we're taking away percentages of all of the other ingredients, allowing for a more concentrated form of that peroxide. Let's see if I can. So what we do is we sell the patient the kit. It comes with the light device with the shorter wavelength, and then the alcohol-based hydrogen peroxide. It also has a charger so that they can charge it every night. So what we recommend is that we have the patient at night before they go to bed, they're going to apply the serum. So they can either use a tissue to wipe the teeth dry. Personally, I don't like to wipe my teeth dry with a tissue, but I will just suck in and dry off my teeth, and then I can paint one quadrant, let it dry, then go to the next quadrant, and same thing with all 4 quadrants. Once that polymer is onto the teeth, now you can't remove it with saliva or with water, and they can just jump into bed with the device, and they wear this device for 10 minutes. So the device will beep at 5 minutes. It beeps again at 10 minutes. It beeps twice, and then it turns itself off. So it's just very dummy proof. They can take out the tray, and when they're wearing the tray, there's nothing in the tray. So they can have that tray. It's just a dry tray that's in the mouth. So they're not soaking the teeth in a big puddle of hydrogen peroxide. There's nothing getting up onto the tissue. They're not tasting any hydrogen peroxide. It's just a dry tray. They can swallow very nicely with it in, or they can remove it for a few seconds and swallow and put it back in, and nothing has been damaged. After they're done with their 10 minutes, then they can take it out. If they're really super compulsive, they can get up and rinse it off and dry it and put it right back into the charger, or they can just set it on their bedstand, and in the morning they can do that when they brush their teeth. So they're going to sleep with this very, very thin serum on their teeth. The polymer is very, very thin. As a matter of fact, you could probably see in the video how thin that is. It's a little thicker than water, not quite as thick as oil. And so you can barely tell that it's even on the teeth at night. So it's not like a varnish where, the tongue can feel it on there, and they can very easily wear that all night long. And then in the morning when they get up, they're going to brush their teeth just like they normally would in the morning before they, get ready for the day. I just wanted to show you this case study because this came from a prosthodontist, Dr. Sybil Antonsen from Florida. And she had a patient come into her practice who had been told over and over again that she could not bleach until after she had had some orthodontic treatment because the crowding and the rotation made it very difficult to do a conventional, to make custom trays for her. And so they did this particular technique on her, the Optic White Professional, and she was able to do it without, of course, you don't have to have trays. You're not taking up any chair time making the tray. And for patients that cannot wear the trays, this worked very nicely for her. She actually had almost a 9-shade change improvement over the 10-day regime. So they're wearing it for 10 minutes. They're wearing the tray 10 minutes for 10 days, right? And then they wear the bleach overnight for 10 nights. And that's what she did. And she had a really nice change. And she didn't even have to have any bleach trays made. So you can see she was very happy with the results. There was no sensitivity. As of this last month now, there is a companion to the take-home bleach. This is the Optic White Professional in-office bleaching kit. This is a wonderful tool for those of you who have maybe you started doing in-office procedures, but it became too much of a hassle, took up too much chair time. This is a great option because you can have dramatically whiter teeth in just about 30 to 40 minutes in the chair. There is no reports of sensitivity or pain in the clinical trial. They actually asked the patient at the time, and then they called them back the day after just to make sure, because sometimes those zingers start up later, but no sensitivity. Very precise serum placement. And the nice thing is no gingival barriers or custom tray. So you can see, a lot of times when our patients come in to do in-office treatments, we have to have somebody who's fairly proficient at placing these gingival barriers, because if you don't fill in every little embrasure or diastema, then you can end up with a lot of burning of the tissue when you're doing these in-office procedures. But with this particular bleaching system, there is no gingival barrier needed at all. As a matter of fact, it's the same technique as the take-home. Okay, and the amazing thing about this is that there is no gingival barrier required. So you're automatically removing 15, 20, even 30 minutes of chair time with no gingival barrier. In this professional in-office kit, it includes the light, the exact same light as the take-home kit, with the lower, shorter wavelength, the higher energy. There's a whitening serum, and you'll notice that this says 10%. But if you remember how the alcohol-based chemistry works, we're removing a part of that percentage, allowing that 10% to become a much more concentrated, enhanced whitening that behaves more like 20 or 30%. Then you're going to have a serum remover, because in the office, they're going to wear the first round for 10 minutes. You will then remove the serum, replace the serum again for the second 10-minute regime, and then remove and replace again for 3 treatments. So you're going to have 3 10-minute treatments in the office. There's also a cheek retractor. There's a charging case and the cords. So the nice thing about this is that you can do a 30 or 40-minute treatment in what used to take anywhere from an hour and a half to 2 hours, and you're going to get a very nice change. And then what you can do is, because the patient already paid for this light, you can send them home with their device like this, and send them home with a refill pen that they can continue to use at home to maintain their whitening. So once again, you place the cheek retractors, you dry the teeth, you paint on the whitening serum, you remove the retractor, and then you place the device and have them wear it for 10 minutes. Then you're going to remove the serum and repeat that 3 times. But there's no gingival barrier required, so none of that pain of having to put on the gingival barrier, and no sensitivity, very precision replacement. As you can see, you can send the patient home afterwards with the light, and then you can sell them a refill pen. I would recommend that you include that pen in the cost, the overall cost of the in-office treatment, and that way you're not nickel and diming them, and then you can just send them home with that so that they can continue to touch up at home. So that's the treatment, pretty easy and fast. I just wanted to show you the results of the clinical trial. They had 79 participants in a double-blind randomized trial, and they had the optic white in office versus a placebo. And you can see that the 79 participants, the mean shade change was about 6 shades in 30 minutes. So it's wonderful, and there were no counts of sensitivity. And like I said, they even called the next day to find out. So now you have options. And I know, for many years I worked for a world-renowned prosthodontist who was a great business person. And the philosophy there was that you always provide options. And that when you provide options, you sell more of everything. But the more, if you have 3 levels, so if you have an in-office whitening option, a take-home option, and then maybe something over the counter like a whitening toothpaste, you're going to sell all 3, but you'll really actually spike this middle option. But you can increase all of your whitening sales and keep it right in your office for all 3 when you offer options to your patients. I thought this was interesting because we're just now hopefully coming to the end of the whole COVID pandemic. And, it was really interesting because they found that there was a webinar smile effect, and that dentists were seeing a rise in cosmetic dentistry requests because people had been sitting in front of their cameras on their computers for a long period of time, and they were able to see all of the defects in their mouth. And so they're starting to feel like, oh, wait, I need to change some things. And so then, of course, when the masks came off, as they're starting to do more and more of, they're saying, hey, I need to do something about what's going on in my mouth. And so patients, you may find that patients are asking more about all kinds of, bleaching and other aesthetic types of procedures. For me, for many years, when I was working in this situation with this world-renowned prosthodontist, we would come in every morning about a half an hour before we started seeing patients, and we would have what we called a morning huddle. And in the morning huddle, we would look at every single patient that was coming in that day. We would talk about whether or not they were having restorative work done, especially if it was anterior restorative. We would want to make sure that we had talked to them about bleaching their teeth prior to doing any anterior restorative work. We would, check to see if there was anybody with a new job or maybe somebody who's getting married, in the next few months or weeks. All of these changes are things that we could discuss about our patients. And then we would make sure that we were kind of all on board with discussing whitening with them. I do have to say that when I worked for the whitening company and I would go into doctors' offices, I found that there were a lot of dental professionals that were nervous about speaking about whitening with their patients. They felt like it was embarrassing to say, your teeth are dark. We know how to make them lighter. It's kind of like saying, you're very heavy, let's do a nutritional counseling and let's see how you can lose weight. It's just an uncomfortable discussion to have. So we would discuss how we could bring that up in an office, without making it uncomfortable. One of the ways that you can do is just make it a point to always take a shade and give the patient, let them hold the shade guide and say, here's where you are, and then let them talk. Just let it be silent. And while you're documenting their shade, allow them to talk to you about, their thoughts about their shade. You can always ask, is there anything that you would like to change about your smile? That's very non-confrontational. And I can guarantee you that even if that patient has major periodontal problems, even if they have a lot of restorative work that needs to be done, probably the most common thing that they're going to say is, I want to bleach my teeth. So you can have that discussion very easily, and it's going to come from them, not from you. I would really recommend that you make sure that you spend some time to manage the expectations. And like I said, we can do that by utilizing the Vita Shade Guide. We can talk to them about the shade of their teeth where they're at now. And, somebody who has got a lot of yellow, orange, and brown stains, they may see a really nice change. People with the blue-gray stains may not see as much of a change as quickly. They might still see a nice change. It may take them longer to get there. And so you need to make sure that you manage the expectations. I would tell patients all the time when they would say, well, how light am I going to get? I would say that's like going to a tanning booth and asking the person in charge of the tanning booth, how dark am I going to get? We know that somebody who has that beautiful olive skin with dark hair, they're going to change shades much differently than somebody who walks into a tanning booth with red hair and very pale skin. And it's the same thing with our teeth. Depending on the shade, depending on whether or not we've bleached previously, all of those things come into play. And we may not get a lot of shade change at all. So you never want to promise a shade change. For instance, I just showed you a study that showed 6 shade changes in 30 minutes. But you don't want to quote the results of that study because remember there were 79 participants and that was the median, which means somebody had a lot more shade changes and then somebody else didn't have as many. And so you can never promise a shade change to your patient, but you can say, I will do my very best to help you to get as light as you want to go. We may or may not get there, but we will do our very best. And then allow them, if you underdeliver, then they're going to be even more pleasantly surprised. I just wanted to show you this little calculator because I thought this was really interesting. And if any of you are looking for ways to boost your revenue in your office, especially, with the pandemic, there were a lot of shutdowns, there's been a lot of staff change. And so we're always looking for ways to boost our revenue. So I like this little calculator because you can look and see if you were seeing, and I just made it really easy, just kept it very simple but you can fill in your own. If you want to take a screenshot, you can fill in your own number of patients that you see in a month in your practice. Let's say you saw 100 patients that month. We know that about 48% of the people who have used a whitening product in the past year are interested in still continuing to bleach. So let's just say 48% of your patients that month are going to be whitening candidates. So when you actually discuss whitening with your patients, let's just say that only a fourth of those patients, 25% of them, decided that they would want to purchase whitening. And maybe out of those 12 patients that you're going to be, now that 25% of 48 would be 12. So maybe out of those 12, 3 of them are going to want in-office bleaching and 9 are going to want to do the take-home bleaching. If you add that up, and actually I had this uncovered, but it's covered right now, but it will show you that if you add up, I think I put $500 for the 3 in-office whitening, because that's about the median across the United States for in-office, and then $200 per patient for the take-home. And we multiplied that out, and it came to $39,600 per year that you can boost your practice by doing a mere 3 in-office patients, bleaching patients a month, and 9 take-home kits a month. So you can see, if you're a dentist, that's a nice boost to your practice. You could even maybe start a bonus program with your employees and have your assistants, your hygienists jump on board with that and provide some sort of a bonus, maybe a fun trip. There's all kinds, the sky's the limit as to how you would like to do that in your office. Or if there's your hygienist and you're boosting, if you're doing whitening as part of the hygiene, as part of your scope of practice, then that's a really nice, new liaison or whatever it is that you decide you want to get with that if you work that out with your dentist. So you can see that when you initiate whitening into your practice, even just on a small level every month, you can really see how that will boost your annual revenue. I am so excited about the whitening because it is something that everybody wants. Everybody asks for it. And so I know that you can provide a wonderful service to your patients by including whitening in your practice, whether it's take home or in office or both, or having all 3, providing some over-the-counter types of options as well. Once again, I would like to thank Henry Schein for this opportunity to be able to speak with you, and have a great night.
Thank you so much, Miss Santizo, for the wonderful presentation this evening. And thank you all for joining us tonight. We did record tonight's webinar and we'll email the recording out sometime in the next week. We also would appreciate your feedback via our survey that will pop up on your screen shortly. Thanks again to Colgate for sponsoring this webinar, and thank you all for joining us. We look forward to seeing you on future webinars.